This segment is sponsored by VCU Health.
The doctor is in and you have questions. October is Domestic Violence Awareness Month. Joining us today is Carol Olson, licensed professional counselor for VCU, who is here to tell us about Project Empower, an advocacy program under VCU's Injury and Violence Prevention Program. Good morning, Carol.
Good morning. Thanks for having me.
What is domestic violence? How do you describe it or define it?
Actually, domestic violence encompasses a range of behaviors and abuse, running from physical violence to intimidation and coercion, battery, sexual assault can be included, and other abusive behavior, and as well as economic, which many people don't understand, or emotional and psychological abuse. So it's a range of behaviors. The severity and frequency actually varies and can run in cycles with the victim. Statistics tell us that 1 in 4 women, 1 in 7 men are victims of violence. That relates to 20 people per minute or over 10 million people a year.
Wow. All right. And of course, COVID-19 had to have a big impact. Can you break that down for us a little?
Sure. With COVID-19, you've seen a lot of headlines about how domestic violence increases or brings a greater risk. And that's because people are being told to stay at home. They're less likely to go to EDs. They're stuck at home with their abuser. So they may not have access to phones or other resources to escape. And two, if violence is more severe or more frequent or more dangerous, as it's showing in statistics here in Richmond specifically, we will see more people coming into our hospitals competing for resources. But we do have evidence-based interventions that help reduce injury and reduce violence.
So let's get to the help part of this. What can someone do if they are experiencing abuse at home?
Many ways. So Virginia has a 24-hour statewide hotline. It's hosted by the Virginia Sexual and Domestic Violence Action Alliance. It's a family abuse hotline. You can call that number 24/7, and they will link you to the center closest to you or to the closest hospital for forensic evidence collection. That number is 1-800-838-8238. Live people, live trained advocates answer that phone 24/7. And we're also here to help. So within VCU Health System, we have our Injury and Violence Prevention Program, and we are Project Empower, serving sexual and domestic violence victims. And so we are also here available to help anybody that comes into our system or gets referred from the community.
VCU has Project Empower, and I think you just outlined some of the things. Closing thoughts about Project Empower.
So we were modeled after a hospital violence intervention program. So we're designed to come in contact with victims or survivors in a unique way, right there at the hospital, right there with their medical providers. So for others, medical centers without such programs, the care stops where a medical intervention ends. But programs like ours, we stay with you. We're there in the hospital. We get called directly to whether you're in the ED or in another outpatient care program. We were the first such program launched in Virginia, and we now provide technical support to other programs opening in hospitals around Virginia as well. These programs are available to patients for no cost. And we have a partner program with Bridging the Gap. So that's the other violence intervention program I'm really excited about and hope that you'll have them on this show another time. Bridging the Gap empowers young victims of violence, for example, a teenager with a gunshot wound, to break cycles of violence. And there is a significant link between domestic violence and community violence that we at VCU are now addressing. And so as we honor Domestic Violence Awareness Month, it's important to speak closely to how, as we honor Domestic Violence Awareness Month, it is important to speak to how closely our programs collaborate to reduce violence. We work closely with our local programs like the YWCA and the Action Alliance, and we work closely with our internal partners around the hospital.
Such an important topic, and so good to hear that there's people out there that want to help. Thank you, Carol, so much.
Sure. Thank you.
To learn more, visit vcuhealth.org/IVPP or their Twitter and Facebook page at VCU_IVPP. Stay with us. There's more Virginia This Morning coming up after a quick break.